Minister, I just really appreciate the energy that you bring to your role, and your office are fantastic to deal with, and thank you very much. I want to mark that first of all. There are lots of schemes, and they're all to be truly welcomed throughout this. And one of the, if there is any sort of a silver lining to this COVID situation, it is that mental health is being spoken about, that there is a destigmatising of it, and we see the supports across all government departments to see it in education, especially as well. So I really appreciate all of that. Mental health services in the community, certainly I know they have been affected by redeployments, and so one of my things would be for you to use your good office to influence that those staff are brought back as quickly as possible, and that we get those services back. I totally understand why we need to redeploy people, but as a priority, if we were to have a list of who gets their staff back first, that we ensure that the mental health services. This week we got a phone call from my dad's GP saying, is he going to take the vaccine, because he's 87, and the sense of relief, I mean, of course he is. He has his sleeve already rolled up, ready to go, but as a family, the sense of relief that worry is coming to an end, of will he survive this, will we still have him in a few months, or even a few weeks' time, is just great. So I think over the coming weeks we're going to have that sense of a lot of families, we're not unique in that, a lot of families experiencing that sense of relief and that sense of their family member is going to be saved from this. So I think it's really important that how we communicate the over 70s rollout programme is really important. I notice we're very clear that it's starting from next Monday. The newspaper reports today are talking about it going on till mid-May. It's really important that we emphasise that's the second dose that'll be done by mid-May. It's not that people are going to have it for the first time, it's that they're actually going to have completed their second doses. So it's really good news, and we really need to hear that. My next point is I'm chair of the Dublin 12 Drugs Task Force. And in the context of mental health, I just want to really honour the work done by those frontline staff over the last 12 months. They have been extraordinary. But they are flagging very seriously to us that the pressure of the current circumstances, all they're experiencing, the people who have been successfully managing their addictions have made a step backwards or relapsing. And so I suppose we have a twofold. I have spoken extensively with Minister Fian about this, but also from a mental health point of view, I think the two dovetail, that we need to be ready to provide support services, ramp up theirs, because there is a hidden alcohol tsunami coming at us, apparently, according to the practitioners on the front line. And I just want to respect what they're flagging to us. They're seeing it, they're taking the calls. They've adapted incredibly, and they are amazing people working out there for us. So I want to say thank you to them, but that we listen to that and start preparing for both Drugs Task Force and addiction services and mental health all coming together and having a very careful, ready-to-go solution at the end of this. Thank you very much.